yourself in the chat, where are you calling in from, and we can get started. Thank you again for joining. I am Heather Anderson. I am the CEO of Global Health Corps. And when I think about my entry into global health, I really started in the women's health and rights space. So I am even more excited for today's salon, because at Global Health Corps, we do believe so critically that our voices are important when we're thinking about what sort of toolbox of skills and experiences do we need to have as global health leaders. Since joining Global Health Corps in 2012, the team and I have had the privilege to work with hundreds of young women to help them find and hone their voices and share their public narratives to inspire and mobilize others. And so today we'll be hearing from 3 GHC alums who have each inspired me. We have Kuta Banda joining us from Lusaka, Zambia, Cinderella Anena joining us from Gulu, Uganda, and Gigi Adi joining us from Brooklyn, New York. We'll hear from more of them soon. But now it is my pleasure to welcome Rosebell Kagumire, our moderator for today's event. Rosebell is the editor of African Feminism, an activist, a writer, and advocate. In fact, just last week, Rosebell was selected for Advanced Media's 100 Most Influential African Women in Media. Congratulations, Rosebell. Thank you so much for joining us today, and over to you.
Thank you, Heather. This is an honor for me to be moderating this conversation with 3 incredible women who are going to be sharing their stories. Personally, my background, I'm a journalist, and before I became a journalist and studied journalism, I knew that I was a storyteller just from childhood, and the power of stories to gather people, to transfer us, to spark our imagination and imagine of possibilities that we may not have is very powerful. As a career, then I have worked with various women of various diversities across the continent and beyond in terms of capturing and writing and sharing perspectives of their stories, and in a way to contribute to a greater world in terms of what better world. For us to make a better world, we have to look at narratives. We have to understand that narratives are powerful, but also narratives are a representation of normalized relations, power relations that we find ourselves in. And therefore, women, as historically marginalized in their different other social identities, can use storytelling as really a form of building power. And that power can be used to build communities, inspire movements, and bring about change and shift and dismantle all the systems that bring about the marginalization in the first place. So we have to remember that women and other marginalized identities have always been silenced. For you to be marginalized, your narrative has to be silenced. So today I'm very glad to share this platform to hear three incredible women share their stories, overcoming silencing and facing the world with your truth and standing in your power. So much as I've not met everybody on this panel, I really look forward for you to hear their stories and their voices. And I hope that they inspire you and open your minds and hearts in terms of considering what's possible and how can we use our stories then, how can we find our own voice and use that voice to bring about change in our communities. I would like to say before we proceed that some of the stories you're going to hear are quite sensitive and deeply personal, including sexual violence, pregnancy loss, and really, I advise you to take care of yourself and to listen and to do whatever you need in terms of needing support, because these are not really light stories in many ways, because they are rooted in our lived realities. So thank you so much for joining us. Before I go any further, I would like to welcome Kuta Banda to this virtual stage. Kuta is a big fan of evidence and health equity, which makes her well suited in her career as a demographer and a public health specialist. She was part of the fellowship of Global Health Corps in 2016-2017. And after completing that fellowship, she led research in her country, in Zambia, under the Ministry of Health for the past 5 years. Recently, she transitioned to be a program officer at the Clinton Health Access Initiative. Welcome, Kuta, and I can't wait for you to share this story with the rest of the audience we have online. Thank you.
Thank you, Rosebell, and thank you everyone for joining in. I am really happy to be here and have the platform to share my story. So my story is really a common story. If we are not careful, we can mistake what is common for what is normal or even what is right. Let me take you back to my time as a child. I was often called inquisitive. Adults told me I had a creative mind. I remember bringing my friends together to perform plays, to do poems, and do all sorts of activities. I wanted to do everything as a child. I was definitely not a quiet child. I spoke out about things that I barely understood, but I really wanted to learn. I was in the anti-AIDS club and I was talking about HIV and I barely understood it, but I was so inquisitive and I really wanted to speak out about it. Fast forward maybe 20 or so years later, I find myself working in global health. Global health is a field where there is so much to care about, and there's so much to speak for my country and generally for the globe. What I didn't realize was that over time, I had lost that inquisitiveness that I had. I had lost that eagerness and that boldness that I had as a child. I had lost my voice, really. And I almost started to accept what is common for what is right, because so many things that I cared about were so common. They were common occurrences for many women, for many people. And to me, that just started becoming normal. And, it somehow started becoming right. That is until I delivered my own little girl last year as a first-time mom. Now, I chose to deliver at a public hospital. And I told myself, with all the knowledge that I have gathered for nearly a decade of working in Zambia's health sector, I thought all that knowledge would protect me. I knew about patients' rights, I knew about maternal health policies and so on. So I thought to myself, all that knowledge would protect me. And yet, I ended up delivering my baby on the bathroom floor of the hospital. From the moment I entered the hospital, when I went into labor, I felt vulnerable. I felt that I was at the mercy of the healthcare workers. I was lucky to have a stubborn mom who refused to leave my side, even when she was told it was hospital policy to not have a bedsider. So she refused to leave, and I was there with her throughout. Now, each time I kept asking, the healthcare workers to examine my labor progression. I felt shut down. They kept shutting me down, and I was told, you have to be strong. You wait. This is your first pregnancy. You still have a long way to go. Be strong as a woman is supposed to be. With all the knowledge I had about patient care, in that moment, I was vulnerable. I couldn't say anything. I felt unheard. As a first-time mom, the anxiety kicked in. I was afraid, and it left me unable to say anything. This is the standard of care. That's what I had to tell myself, and I had to accept it. The only time I received the care that I would have wanted was when I was lying on the bathroom floor with my baby's head about to come out and my mom screaming for help. You see, this story is very common for most women in most of the developing countries. And like many countries, Zambia's health system, I felt for some time is more reactive than preventive. Our health system is oriented to provide a low bar of just keeping us alive. And in some cases, Lack of resources plays a very big role in the quality of care that we receive. The holistic kind of care that we are supposed to receive is very, very, very rarely received. But shouldn't that be what we aim for? Over the past year, I have asked myself, what would have happened if my mom wasn't stubborn enough to stay with me when I found myself on that bathroom floor? What would have happened to me? What would have happened to my precious little girl? Thankfully, I had a healthy birth. I had some tears, very big tears, but nothing that required life-saving surgery. Many other women like me who share this common story are not so fortunate. Still, it has taken me time to heal from the undignified experience that I felt I went through. And yet this story is very common. But should it be common, really? Shouldn't we aim higher? Shouldn't we want more? I look at my little girl sometimes and I shiver, imagining going through what I went through if she grew up and decided she wanted to have a baby. I ask myself, what kind of healthcare do I want her to get? What kind of healthcare will keep her safe and sane? And what if she decided to be a global health leader? Will she be fighting the same uphill battles that we are fighting? Where a lot of women in low and middle income countries hold just about 5% of leadership position. Should they still be fighting these battles? We need to do better for our future generation. And I told myself that I have to offer my skills, my expertise, my position, every opportunity that I have to do better. I need to bring back the inquisitiveness that I had as a little girl and be able to learn more so that I can tell the stories of these women, of these young people, the stories that matter to me. I vow to tell these common stories until they become uncommon, unheard of, and yes, unacceptable. And I think that it is time to allow that those who are most affected, those who are most impacted with health inequities, to direct the decisions, to direct the funding and the power. In most cases, decision makers are looking at numbers. It is time to put faces to those numbers. When you make a decision, it is time for you to put a face to it. I'll never stop saying it. Health is a human right. But I would like to add that quality healthcare is not a luxury. It is a necessity. In most of our developing countries, we do say that no woman should die while giving life. But I should also add that also no child should die leaving behind an unlived life. Are we ready to make this vision a reality? Are we ready to make these common stories uncommon? Thank you so much for listening.
Ooh. That's really powerful, Kuta, and vulnerable. And thank you for coming to this platform and being this brave to share with us your personal experiences, because this requires us to dig deep inside us for us to be able to confront that and link that to the realities of many other people that are around us. Thank you for that. Next, I would like to welcome Cinderella Anena to this stage. Cinderella is Ugandan, just like me. I'm so happy to share this with you, this stage with you. She's a global health development practitioner. Cinderella is deeply passionate about community development and good music. I love music too, and books. She joins Global Health Corps as a fellow from Reach a Hand in Buya in 2017, and she has worked on cross-cutting issues of gender-based violence, HIV, youth empowerment, migration rights, and many more in Uganda. In her current role with UNFPA, she spearheads initiatives aimed at expanding contraception access in Uganda and some of the most marginalized communities in Uganda. And I can't stress how much this is really important, contraception and sexual and reproductive rights in our countries. You're welcome, Cinderella, to share your story. You have the floor.
Thank you so much, Rosebell. And I'm happy to use this opportunity to share my story. To start with, I was born and raised at the height of armed conflict in northern Uganda in the 1990s. At that time, very few women and girls around me seemed to have a choice over whether or when and even how many children to have. It seemed like one day we were living our lives, sometimes even daring to dream about a future beyond the daily realities of conflict. And the next, we are thinking about bringing a new life into the world, and sustaining the life born becomes an entire focus by necessity. During this very time, as a teenager, I lived in fear of being abducted by the rebels. Tragically, one of my close friends suffered from a raid by the rebels in her hometown, and she was later raped. Soon after, she learned she was pregnant as a result. Unfortunately, during the first months of her pregnancy, her uterus ruptured. She lost a baby and the ability to conceive again. My friend lost the agency to choose when and if to have children. As I grew up, I longed to do something to ensure that other women and girls wouldn't face these same challenges. We have many survivors of conflict-related sexual violence in Uganda. Like my friend didn't have even the opportunity to be heard. As a teenager, I first discovered the power to use my voice to make a difference when I was in primary school. I was a member of a school club, and I was able to strengthen my skills in poetry and essay writing as a means to amplify the plight of girls affected by the armed conflict. Now, a decade plus, I find myself working in global health. I've continued to seek opportunities to sharpen and use my voice to advocate for women to be able to make choices that matter about their lives, choices to be free from violence. For the past several years, we've been making great progress in global health work. Some of these progresses are steadily supporting us to expand access to contraception for women in Uganda from all walks of life, and driving through to make sure that cases of gender-based violence reduces. And then last year, COVID-19 hits all of us. Now, instead of the bombs and the soldiers of war, we're currently facing the invisible threat of a virus. And we faced the lockdowns and resource constraints, and we have seen a jump in unwanted pregnancies, a jump in cases of GBV, and the pandemic has largely contributed to these very difficult problems we are facing. And so how do we ensure that the progress we've been making over the years is not reversed? We've seen the headlines have been dire. At my workplace, we've been hyper-focused on ensuring continuity of service delivery amidst the challenges of the pandemic. Although school closures are affecting young people, we are having community initiatives to deliver age-appropriate sexuality education to ensure that we link young people to the services available. These are the solutions that we are seeing happening, but we need to commit to finding more and more. For me here in Gulu, Uganda, every day I think of my friend, and I'm reminded of why I do this work. I think of the fear I have lived with daily, worrying of what my own fate might be. It's my wish to create a world in which young girls and women in Uganda and beyond no longer fear that their agency will be ripped from them. But I can't do this alone. Until more women like myself and you who are here are in proactive leadership, making decisions about policies and funding, we won't see lasting change fast enough. We know women in leadership make decisions based on a deep understanding of their communities, and most importantly, a commitment to equity. For every day we delay changing the leadership landscape, too many women and girls, like my friend, lose the right to choose when and whether and how many children to have. But I strongly believe that together we can and must change this. Thank you for listening.
Thank you so much, Cindy, for that powerful story and linking all the intersections that come between a woman and a girl in our countries in terms of accessing healthcare, and also looking at the challenges of conflict and specific impact on, and long-lasting impact on communities. Thank you so much. I would like to welcome Gigi Adi to this virtual stage. Gigi is a Palestinian American advocate who brings expertise in both social work and public health to her work. Gigi served as a Global Health Fellow at the Boys and Girls Club in Newark from 2017 to 2018, and has since headed up the design and rollout of inclusive community health initiatives in her role with the Arab American Family Support Center in Brooklyn. You're welcome, Gigi. It's very important to always have varied women's experiences at the intersection of different systems. So last, definitely, but not least, I would like to welcome you to this stage, and I look forward to your intervention.
Thank you, Rosebell. As I share part of my story, you should know that I'm unapologetically Palestinian. One starting point for my family is when my father and his family were expelled from their home in Palestine in 1967 and became refugees living in Jordan due to the Israeli occupation of Palestine. Several years later, my parents met, married, had my brother, and eventually made their way to Lawndale, California in pursuit of freedom, autonomy, and opportunity, the so-called American dream. 2 years later, I was born. I grew up attending Palestinian events and protests with relatives who chanted "Free, free Palestine" with a mix of pride and pain. I was taught to be proud, to celebrate my roots and my heritage. As I got older, though, I noticed how the Arab news channels my parents watched portrayed events in Palestine and Israel differently than the English news channels. More and more, I thought about my family in Palestine who continue to live under Israeli occupation. I wondered what their life was like. When I was a teenager, I got a glimpse through a visit from my maternal grandmother. My family was fortunate enough to get her a visa, to get Teta Mary to come to the US to visit us. She had sparkling silver hair, a beaming smile, and the ability to make people laugh, even in the most painful moments. Her electric energy made people, especially me, want to be around her all the time. After Teta Mary went back to Palestine, we talked by phone frequently. Over time, her health started to decline. We discovered that she had kidney failure. Suddenly, she needed dialysis treatment every 2 days. When I found this out, I was oddly relieved because I knew that with dialysis treatments, people can survive kidney failure for several years. But Teta Mary was not always allowed to pass Israeli checkpoints to get to her dialysis treatment. On days where she was able to pass, the hospital's equipment was frequently broken. There were some days where she would arrive to the hospital at 9 a.m. and not receive treatment until 9 p.m. Israeli citizens, however, did not have these same challenges as they have access to top quality medical treatments. Because of the infrequency of her treatment, my grandmother's blood poisoned her body and she passed away soon after falling ill. Teta Mary's passing devastated and infuriated my family and me. Medical apartheid cut her life short. She died sooner than she had to because she was Palestinian. The more I learned, the more I realized that medical apartheid exists in many places. I realized just as hospitals are purposely underfunded in Palestine, certain hospitals in the US are also purposely underfunded. Which ones? The ones that primarily serve people who have been historically marginalized based on their race, ethnicity, and socioeconomic class. The American dream isn't as real or as accessible as we're made to believe it is. We know that people in lower income communities and Black, Indigenous, and communities of color in the US have less access to quality, affordable healthcare than their wealthy white counterparts. At the same time, racism and classism pose serious threats to the health and well-being. These issues are systemic, but that doesn't mean we're helpless. We're far from it. Systems are built and reinforced by people, so we have to consider who are the people making decisions? What are the values that guide them as they determine the fate of others' lives? What kind of expertise and lived experience do they bring to their influential roles? In global health, philanthropists, investors, and funders have a huge amount of power. To me, that means they also have the responsibility to equip those most impacted by inequities to lead the way. COVID showed us how important this is. It is past time to listen to people from historically marginalized communities, to open doors for them and to cede power. 19 years later, I'm still angry about my grandmother's death, but I'm channeling that anger into a career advancing health equity. That's why I've spent my years in college, in grad school, and as a GHC fellow, building my knowledge and skill set to be able to change this reality. In my role at the Arab American Family Support Center in Brooklyn, New York, I'm working to ensure that Arab, Middle Eastern, North African, and South Asian communities in the area have access to information, education, and vaccines. I do what I can to make sure we're not forgotten, to make sure we're seen, heard, and cared for. Because no one should ever have to hear that their family has died because a life-saving treatment was just out of reach. No one's birth community or nation, skin color or gender, ethnicity or class should ever be a death sentence. It's past time to make equity our shared goal. Equipping diverse, equity-driven leaders to drive change individually and collectively will get us there faster. Ultimately, whether they exist in the West Bank and Gaza Strip or Brooklyn, inequities anywhere leave us all less free. Thank you.
Thank you. Thank you so much, Gigi, for that powerful story in tapping into the different social, cultural, social markers that exclude us in different ways across nations, across continents, within communities, and also reflecting on individual stories and power of channeling anger into action. Thank you so much for this powerful story. Now we're rolling down into Q&A, where we'll bring our audience into participation to interact with these stories and the storytellers at the heart of these stories. But before we go to the audience, I would like to just have a few questions for our storytellers. You all joined the Global Health Corps Fellows a few years ago and have since stayed engaged in the alumni community and the network. How has this experience impacted your willingness and ability to share your story publicly? Because it's not an easy thing to take a public platform. You have to face your own doubts as yourself, but also so many other challenges. How has this experience shaped your willingness to come here and share with us? Thank you. Anyone can, pick it up.
I'll give it a take, Rosebell. Yeah, I think that basically from the time that I was a fellow and even the alumni programming, I think I have had a lot of opportunities to have, different writing, storytelling trainings and advocacy trainings. We have had, I think, a bit of that here in Zambia. So with all those interactions, I think they have allowed me to realize that, okay, this is something that is still important. You can still speak about it. And also my work, especially now with Chai, interacting with maternal health and women, maternal health issues, SRH issues, I keep hearing these women's stories, these people's stories, and they do not have the opportunities and platforms that I have. So it is up to me. I feel obliged to be able to speak up and use the opportunities that I have, because many others who would love to share the stories do not have them. Yeah.
Thank you so much, Kuta. Anyone else wants to intervene for this question?
Yes. So being in the global health core community, we learn the power of telling the public narrative, and most importantly, being vulnerable, because when we get vulnerable, we get to see the deep insights of the problems our community face, the inequities that exist, and it enables us to craft from the experiences better ways of ensuring we address not only the systemic challenges, but also advocate for better approaches that meet the needs of those who are underserved, vulnerable, and marginalized. Yeah.
Yes, and just to add to what my colleagues Kuta and Cindy just mentioned, I think what is also important to highlight is leadership programs like the Global Health Corps and others that exist to give folks the opportunity to have a platform to speak. You know, I've been fortunate enough through Global Health Corps and a few other avenues to have a platform to share my story and to share a little bit about myself. And I think it's so important for whether it's a fellowship experience or an employer, whatever it may be, I think it's super important for them to give, you know, folks within their own communities a platform to share their stories, because when we're given that opportunity, even though it might be very scary and, you know, might entice a little bit of fear in us to share, you know, more often than not, there's a reward at the end of it.
Thank you so much for the quick reinforcement to the other speakers. I would like to really open up a bit for one or two questions. Do we have any questions from our chat or any speakers? Let's look through. Yeah, there's one question about what individual patient needs and priorities are being overlooked or unmet by the existing global health programs that need to be elevated to higher priorities. Kuta, do you want to respond to that?
Sorry, Rosebell, I actually didn't hear the question in full. Do you repeat it?
Yes, please. What individual patient needs and priorities are being overlooked or unmet by existing global health programs that need to be elevated to higher priorities? Patient needs.
I think for me, one of the first thing that comes to mind is really issues of quality. Like I said, and from my story, you know, our health systems are, you know, maybe it's because of resources, I don't know, they focus on keeping you alive. We just do not want to have those maternal deaths. We do not want to have that bad record. But how about, you know, giving me the care that I need? Or what if the care that I need at that point is mental health? So I think looking at the quality of the care that is being provided is a very key aspect, and it's the first thing to actually healing.
Thank you so much. I would like to bring in a comment about women leadership in health has to relate much to having platforms where women can not only voice out their issues that affect them, but rather engage directly in formulating actions and strategies for system revamp. And Leonard says that in most African countries, political leaders have the final call and young people are not involved. That's true. And I think that the three of our leaders here and storytellers are showing us the way that they're already adding into that inclusivity and shaping policy in their different communities, and emboldening the voice of the community to demand better is also very important. There's another question. Can you tell us how sharing your stories has pushed the needle in your work at the structure level. I would like to hear from you and Cindy or Gigi. How has this sharing your story translated, I think, somehow to at the structure level? How do you relate to that?
Okay, thank you. So sharing my story has been very critical because I speak from a personal and a very passionate point of view. And whether I'm speaking to the women and girls at the community levels, or speaking with the district officials at district levels on tables of decision making, they get to hear the passion and the need to focus on the issues that matter to us. And that's very important as young women and young leaders, because if we don't show the initiatives of why we care about these issues, then no one will give us the opportunity to be heard or to consider what we are working on as important for action to be taken. Yeah.
Yeah.
Thank you, Gigi. Any quick comments?
Yes, just to add to that, I think it takes a lot of vulnerability to share your story, such intimate stories of yourself. But I think vulnerability is what connects folks to one another. I think oftentimes when we think of leaders who are tough or rigid, but to me, that's not what a leader is, right? A leader to me is someone who can be vulnerable, someone who's able to connect to folks. And I think that is part of the process. And for us to make change and for us to create change, we have to be a little bit more vulnerable and share our stories in order for us, for people to know what it is like for our community to go through what they're going through, and for us to actually have tangible, strategic ways of how to move the needle down the line.
Thank you, Gigi. I would like to bring in as more people as I can. Very important question from Rose that talks about the power dynamics of between countries, that the fact that the global health NGOs are headquartered in the US or the global north, and while communities we are talking about are in the global south, using that because that's still important. How can communicators then in the US most effectively partner with communities to uncover important stories in a way that doesn't further marginalize communities or continue harmful narratives? So ethical storytelling and being aware of the power dynamics and the positionality where you are is very important, and understanding not just your privilege, but also the privileged position and the country you occupy. And therefore, when you're consuming stories of the people that where programs are, that you, as much as possible, try to level that power and also respect to knowledge, local knowledge systems. Oftentimes there's lack of that respect. I would say that. Anyone wants to jump onto this inequality between nations and in narratives and how to ethically tell stories of marginalized people?
Yeah, I just wanted to speak about that and say that we must realize that the global south has a wealth of intelligent people with abilities to tell our stories as people from the global south and low developing countries. And so one of the things that we need to do is to change the narrative that what comes from the global north is legitimate and the most appropriate strategy of addressing some of our systemic problems, but rather letting us speak in the most organic way as it is and not change meaning to what we say, because it's one of those, challenges we've had over and over again. And so to make it better is provide the support, but let it be a bottom-up approach. Yeah.
Thank you, Cindy. I would like to pick a question by Shanya, if I'm saying it well. What made you decide to speak? How do you build courage to share your story? Gigi, Kuta.
Okay, I can give this a go. That question, if Brittany was here, she was going to say, I struggled with it. I struggled to be able to share this story because I mean, even culturally and so on, it's been like, this is, you don't want this being out there, you don't want your child to grow up and know that she was born on a bathroom floor. There are very few people actually within my circles that know this story. But again, I think I really got the power from the work that I'm doing right now with, storytelling and really working on getting those stories on the tables of policymakers. I've interacted with a lot of powerful women in the communities who have had a lot of stories that will literally leave you into tears. And I feel like as a global health leader, a growing leader, I have a responsibility to use the opportunities that I have and really tell these stories. So like Gigi said, you just have to allow yourself to be vulnerable and be used as a vehicle to communicate what others may not be able to communicate. I think that's what gave me the strength to tell my story.
Yeah, and if I can just add to that as well, I think people are always going to be fearful to share their story. I don't think it's ever easy. I mean, even before sharing my story today, I was a bit nervous and fearful. But I think what's important, and for me, I didn't see many people who look like me sharing their stories because they weren't allowed to. We were, just as mentioned before, marginalized people are often silenced. And so for me, because I was given this opportunity, I wanted to share in hopes that maybe even someone else who might see this and might even identify or relate to me, or any of my other colleagues on this call who share their stories, know that they're able to also share their stories. For the longest time, I've been crippled by sharing my story because of my Palestinian identity and how people may view me or what I say. But it's time to kind of just like throw that out and just share as much as possible. It goes back to just being able to connect to people on like a real human level.
Thank you, Gigi. And just one question that I would like to hear connected to this: what advice would you give for aspiring women leaders who face challenges telling their own stories?
Okay, I would start to say, if you don't speak, then no one will speak for you. You must get up, believe in yourself, and say, if Cindy, Gigi, Kuta, and everybody here can do it, I too can do it. And we are here to support you find your voice and get heard. Yeah.
Thank you, Cindy. And there is one last question I'll pick. It's, I think, kind of grouped questions together. How did you come to Global Health Corps, and what skills did it equip you with in order to share your story? It's kind of related to what we talked about, but feel free to build on that for those asking, because these were different questions coming through. What's your journey to Global Health Corps? How does it look like in summary? And how did it help you?
I guess go ahead, Kuta, go ahead.
Yeah, I think that really, for me, GHC was a turning point in my career, and it has ended up being a turning point in my life as well. I heard about GHC. I knew some fellows, so I that's how I knew about GHC. And really, from the time I was a fellow, I joined the ministry. It really gave me opportunities to be able to do work that I cared for, and to also discover myself, and even the work that I am doing now, my outlook at life, my realization that my demographic background really looks at numbers, and now with the experience that I have, the opportunities that I've had, it really makes me realize, as decision makers, we look at just numbers. We do not really make it personal, but healthcare is personal. And through my journey in GHC, it has helped me to realize that we need to change that narrative, and we need to be able to advocate for faces, for people's names, people's faces to be put right there as you're looking at the numbers, because that it helps you to make a human decision.
Thank you, Kuta. Anybody on that? Okay, I need to fetch a few more comments from Caroline. We need to be more intentional and harvest those voices that will force change. is talking about how do we unearth a whole different narrative than what we know on policy. I think it comes back to the fact that people in policy must look like the people whom that policy is supposed to benefit ultimately. You know, if they don't look like you, then there are chances you're getting it wrong. And if they don't, then you should put basically short-term and long-term plans to make sure that those making policy look like the people it is intended for, in order to make sure that policy is rooted in lived realities and it really goes to the heart of people's needs, you know? And there's only one way to do that, by bringing those who need it to determine that policy. I could say that. Someone else has shared something about allyship and good men. As you know, I'm a feminist, so I'm going to respond to that. Allyship is very important, whether good men or whether good people from outside marginalized groups. It's not enough to be good. We are dealing with systems. We're dealing with personal lived experiences. So oftentimes it's important to be an ally, but it's important to know your place as an ally. You're not here to overshadow anybody whose lived reality you're trying to support. So again, don't center yourself as an ally. I would say, please, your goodness is not what is important. It's about what you bring and the knowledge you come with and the self-awareness that you're not coming here to overshadow yet another marginalized groups. And we see a lot of that happening. Oftentimes in sexual reproductive rights, you find a lot of agencies and voices, very male, yet, you know, this is something that specifically and predominantly affects women, especially in our continent. So I would say, whatever, if you're an ally, be willing to listen, to learn, and let the people who are affected guide you. Do not come, you know, with that idea. Anybody wants to, to add on to that? We still have like a minute to that. Any experiences with allies, our speakers today?
Yeah, so, you know, Rosebell, in the Ugandan feminist movement, we've had male allies. And oftentimes when we give them opportunities to collaborate with us, they kind of tend to use it to reinforce some of the toxic masculinity and patriarchal beliefs and values. So the best thing to do is be with us, but don't overshadow our space like you mentioned, because it takes a lot of courage and work to even get the voice to speak and be heard. Yeah.
Exactly. Any other experience, short intervention on that? Okay, no worries. So the other questions were really majorly around how Global Health Corps works. So please, if you can share social media links, website with participants so that they can get more information after this session, because there's a lot of interest in the fellowship and knowledge. That is very important, because knowledge is power, and when you access knowledge, then you can change the world for the future, and getting the knowledge from the right source, you know, like we're hearing from our storytellers today. Thank you, everybody. I see a lot of comments, people relating to our speakers, you know, re-emphasizing some of the points that have been brought along in our conversation. I would like to just thank you so much. A round of applause for our storytellers. Very key reflections that I have taken away personally, and knowing your position and power and working towards overcoming silencing, because you're marginalized because there's a system that silences you. There's a system that silences that particular community, but also being aware of how not just a woman, but you also have other identities that put you also further at the periphery. Cinderella telling us about stories of war. If you're a woman, a girl growing up in a conflict, that puts you at a further disadvantage. Talking about women and maternal health and how women interact with the healthcare system is very different from how men and other people would interact with in this particular issue of maternity. And then Gigi reminded us really of the importance of connecting the dots, not just in our communities, but across countries, and reminding us of the marginalizations and the histories and legacies of colonization, occupation, and how all these come down to affect us as people. So these have been very powerful stories, and I take away these kind of linkages, and our storytellers have been reinforcing each other. If you listen properly in those stories, there are common threads: finding your voice, overcoming the violence, but also using that voice to bring in other people, because your story is not just your story, it's a story of the collective, as we are seeing with our storytellers today. So thank you so much for this courage. I want to close by saying that, you know, it requires really vulnerability to come in front of people, whether 20, 100, 1,000, to share your personal story. And it's never easy. And sometimes it's not even it's not even like the first time you have told the story, but every time, because it requires you to get into that part of yourself that is traumatized. And healing is also a continuous process, is a very important aspect of storytelling, and giving yourself time to heal. And determining when to tell a certain story, not to tell a certain story, which audience you want to tell your story, is also very important. So it's never pressure that you must tell your story. Find that journey. What aspects of the story are you comfortable with? What are those you're holding back? Why are you holding that back? Have that conversation with yourself, but without pressure, really, because ultimately it's a journey about healing, and a journey about creating systems, cultures that respect people and equalize in access to health, but also in terms of other aspects of social justice. So thank you, everybody. There's a lot of power in vulnerability and authenticity. I tell my story, a lot of them, my different stories, different audiences, so I could relate to many of these stories that our storytellers did. So the more leaders, we need to know that the more leaders lean into lived experiences and understand them and listen with intention to transform those systems and also bring in the marginalized people, the better we can have a brighter and healthier world that we are trying to work on. So beating marginalizations and centering people that we are trying to do programs for is very important. Thank you so much. It's been a great, impactful evening wherever you are. I'm in Dakar, Senegal. I would like to hand this over back to Heather. And this for me has been very, very powerful, and the story is very moving. I would like to hear more how we can continue this kind of salon and more people gaining from our skills of this storytelling. Thank you so much, and I applaud you, all of you. You're very brave women.
I couldn't agree more. Thank you so much, Rosebell, for facilitating this really powerful session today. A big thank you to Gigi and Kuta and Cindy for your willingness to be here on this platform. It was really amazing to have you, and thank you for spending your time and being vulnerable and powerful and authentic and everything in between. Also, big shout out to the GHC team to really help put this all together. I want to make sure I acknowledge their work. It was really appreciated because, as I think we've seen and heard today, and as our panelists have shared, storytelling is a learned skill. None of us are necessarily born knowing how to wow people on stage, and that doing so requires ongoing practice and intentional skills development. It can take encouragement from others throughout our lives to be able to be at a place like our panelists today, to be able to share your story. And so in that spirit, we are thrilled to invite all of you to join us for a storytelling workshop that we're hosting at the Women Leaders in Global Health Conference. It will be an opportunity to participate in part of the GHC leadership curricula that Gigi, Kuta, Sandral have all participated in. So we love that and hope that many of you can join us. It will be on Tuesday, November 16th. Stay tuned for more details. I want to thank you all again. With that, I want to close on a quote by Margaret Atwood, who is an author of the dystopian novel, The Handmaid's Tale. And she says, "You're never going to kill storytelling because it's built in the human plan. We all come with it." So that's an inspiration to not only those of us that are on the panel today, but to all of you that have joined us. So thank you again. It's been an amazing hour, and please all take care. Thank you again, and have a good rest of your afternoon, evening, wherever you are in the world. Thanks, everyone. Goodbye.
Thank you. Bye-bye.